Miss Gina, 65-year-old lady, is a diabetic for 20 years. She comes to the outpatient department with an ulcer on her left toe. Take a history, do a clinical examination, and counsel the patient. After greeting the examiner, "Hello, Miss Gina. I'm Dr. Jane. I'm the junior doctor here, and I've come to examine you." "Hello, doctor. I understand you have a problem with your toe." "Yes, doctor. It was bothering me for a while. Only today did I notice the smell coming from it. It makes me sick." "Don't worry. I'm here to help you overcome the problem. Did you notice the ulcer earlier?" "Yes, doctor. Since 2 weeks." "Did you notice any discharge of pus or blood from it?" "There was some pus yesterday, doctor. But no blood. No, not that I recall." "Do you have any fever?" "No, doctor." "Did you injure your toe recently?" "I can't recall." "Have you had any problems with feeling your footwear with your feet?" "No, doctor. I didn't notice." "Have you felt you're walking on cotton at any time?" "Yes, doctor. I've been having that feeling since the past 1 year. Sometimes I even have a tendency to fall because of that." "Can you feel where your foot is when you're lying in your bed?" "No, doctor, not for a year." "Have your slippers fallen off and you haven't noticed it and you were not able to grasp it?" "No, doctor." "Any loss of sensation in your hands or anywhere else in the body?" "No, doctor." "Do you have any leg cramps on walking?" No, doctor, I don't." "Did you notice blue discoloration of your toes at any time?" "No, doctor." "I understand you have diabetes for 20 years. Which medicines are you taking for it?" "I'm on insulin, doctor." "Have you been keeping an eye on your sugars?" "I haven't checked it in 6 months, doctor." "Have you been taking your insulin regularly?" I do miss doses on and off, but you know how busy one can get." "What about your diet?" What exactly do you want to know, doctor?" "Do you take any sugary foods?" I do have a sweet tooth. I do take chocolates every now and then." "What about you taking non-vegetarian food? Are you a vegetarian or a non-vegetarian?" I'm a pure vegetarian for the past 20 years, doctor." "Gina, how has your vision been? Have you been having any problems with seeing?" No, not really, doctor. I use glasses though." "And what about your night vision, Gina? Are you having problems seeing at night?" "Yeah, I do find it hard to see at night, and maybe for about 2 years now." "Do you have a blood pressure problem or a cholesterol problem?" "No, doctor." "Have you had a heart attack at any time?" "No, never, doctor." "Do you drink alcohol?" "No, doctor." "Do you smoke?" "No, doctor." "Gina, I think your blood sugar may be out of control, which is why you seem to be having some nerve damage in your foot. You also seem to be having an infected ulcer in your toe. It's probable that your blood sugars being high have delayed the healing in that ulcer. Also, you have some kind of nerve damage that could be related to your being a pure vegetarian, because vitamin B12 can be deficient in people who take pure vegetarian food. Is it all right if I examine your foot?" "I would need to undress you from the mid-thigh level. Would that be okay? I will call in a chaperone." "Sure, doctor." Now the examination. At this point, we talk to the examiner and to the patient. tell the examiner, on inspection, I cannot see any loss of hair. There are no nail changes. The skin over the foot appears normal, except for a 2 into 2 centimeter ulcer on the ventral aspect of the right big toe with pus in its base. Gina, can I feel your feet? Yes, you may. I don't feel any increase in warmth in either foot. Gina, I would like to feel the pulses in your feet. Would that be okay? Yes, go ahead, doctor. I feel now for the dorsalis pedis artery, which is lateral to the external hallucis. I now feel for the posterior tibial artery, which is behind the medial malleolus. Both seem to be pulsating quite well in both the feet. Now I would like to check for sensation. I'm going to check for fine touch sensation with a cotton wool, and for the sole I'm going to use monofilament. Gina, can you please say 1 every time you feel this touching you? And then we go ahead and touch the medial and the lateral aspects of the sole, and then we move on to the dorsum. She says she can feel it. Now, Gina, I'm going to test for pain sensation. I'm going to use a neuropin. Please do say 1 if you can feel pain, but don't say 1 if you can only feel touch and not pain. And then you feel in the exact same spots on the medial and lateral aspect of the proximal and distal sole, and then move on to the dorsum. She says she cannot feel anything. And then that neuropin is discarded into the sharps bin. Now, Gina, I'm going to check for vibration sense. I'm using a 128 Hz fork. Can you feel this vibration on the ball of your toe? No, it's just feeling like you just touched it with something cold. It's not feeling like a vibration or anything. Okay, now I'm going to check on the ankle bones. Can you feel vibration here? No, I can't feel vibration there either. Okay, I'm going to check on your knee. Can you feel vibration here? Yes, I can feel vibration there. Okay, so you seem to have loss of vibration sense in your feet and ankles. Now I'm going to check for joint position sense. I'm going to move the ball of your big toe only slightly up and down, touching only the outside aspects of the toe and not in the middle. And you please close your eyes and let me know if you can feel if it's up or down. It's up, doctor. Now, can you tell me, is it up or down? It's down, doctor. No, unfortunately, Gina, you have not said correctly. You do have a problem with your joint position sense. Gina, can you please grasp this card in between your toes and grasp it tightly, and I will try to remove it from in between your toes. Okay, doctor. And Gina is able to grasp the card. Now could you please move your foot upward against the resistance of my hand? Now could you move the foot downward against the resistance of my hand? Good. You seem to have good muscle strength in your feet. Now I'm going to check the reflexes. So I'm going to bend your knee and I'm going to knock your knee with a hammer. And she has deep tendon reflexes. She has a knee jerk, and I check for the ankle jerk, and that also seems to be all right. Now, Gina, if I may please check your footwear. I need to inspect it to see if there are any pointy edges, whether there are any holes in it, so that you need to change your footwear if it's defective and you're prone to have injuries. Now I'm going to check the gait. Can you please walk for me and show me? Okay, Gina, so you seem to be having a nerve destruction in your feet, and this is likely to be due to uncontrolled blood sugars because you have not been checking your sugars quite often and you have not been compliant with your medicines. You may also be having a component of vitamin B12 deficiency because you're a pure vegetarian. So I would like to do these following tests for you. I would like to do an HbA1c that will tell me how much your blood sugars have been over the past 3 months. I would check some cholesterol tests, kidney tests to see if your kidneys are working all right. That is a creatinine and a urine albumin creatinine ratio. I would do some liver tests. I would do a blood count to see your hemoglobin and your WBC count. I would do a pus culture from the site where the pus is coming, just in order to see if there are any bacteria growing in it. I would also like to do a blood vitamin B12 level and correct any deficiency if it's there. I will also do a nerve conduction study to see the level of nerve damage there is. The plan for your treatment is that I would be putting you on a course of antibiotics to treat the infected ulcer, which would be Augmentin. I also need to adjust your insulin dose in order to bring sugars under control. If you have vitamin B12 deficiency, I'm going to treat you for that as well. Of course, I need to take care of your feet, and you need to keep checking your feet every day, wash them with soap every day, keep them clean so that they don't get infected. Avoid walking bare feet. And please do exercise every day for at least 30 minutes. Unfortunately, the nerve damage may not reverse, but with good control of sugars and correction of any vitamin B12 deficiency, we can prevent it from getting worse. Thank you.